A union is an organization of workers who come together in order to achieve a common goal, such as protecting the integrity of their trade, improving safety standards, and attaining better wages and benefits in terms of vacation, healthcare, and retirement, and better working conditions. In New Zealand, NZNO is the largest healthcare union, representing 51,000 nurses and healthcare workers. If you are new to New Zealand, you may wonder, is it necessary to join a union? What are the pros and cons? Details up next. On my previous video, Leandrino Patla asked, do you know if I can really benefit from NZNO membership? Any examples? Or is it just an unnecessary expense? Well, this is actually one of the commonly asked questions that I get from this channel, and it makes me happy because if people are already asking about union membership, it means that they already got their NZRN license and they got offered a job, which is really exciting. So congratulations! So, general answer, at least in my own personal point of view, yes, it is worth becoming a member of a nurses union in New Zealand, especially if you're an immigrant nurse, and that is just based on my experience working here in New Zealand in the last 10 years. There are actually different nurses union in New Zealand. The union with the most number of members is NZNO. There's also PSA and Nurses Society New Zealand. However, for this video, I will focus on NZNO because that's what I'm most familiar with. Please note, I am not a union delegate, and obviously this is not a legal advice. I am just sharing my personal experience. And if we are just meeting, kia ora, my name is Binibining Veronica. I am a Filipino nurse living in New Zealand, and on this channel, I talk about nursing and life in New Zealand. So if you're new here, please hit like and subscribe. Salamat po! Before I started my clinical placement for competence assessment program, our tertiary provider said that I should get an indemnity insurance for students and that I can apply through NZNO for an indemnity insurance. And if this is the first time that you're hearing about competence assessment program, I have created several videos about that, explaining what a program is like, what it is, who it is for, who can be exempted from it. So please do check that out. I will write the link above so that you can go watch those videos at your own time. Anyway, at the end of our clinical placement and after I have obtained my NZRN license, there was an option to sign up for full membership with NZNO, and to be honest, I didn't really understood it at that time, and it was quite expensive as well, especially if you're just moving to a new country. However, I've always believed in the importance of becoming a union member, so I've signed up. And as I have mentioned before, my first job in New Zealand was working as a nurse in an aged care facility. And for this specific employer, my salary was based on an individual agreement. You would notice that in my previous videos, when people ask about salary, I explained to them that it will be based on who your employer is, your years of experience, and if it's an individual agreement versus a collective agreement. So in summary, collective agreement is when the union negotiate the salary and benefits for you. In my first work environment, I think they didn't have a lot of NZNO members. Therefore, collective agreement wasn't really an option for us. So for me at that time, I didn't really felt that I got much of the benefits of the NZNO membership. So in comparison with my second job, because I worked in a public hospital and because NZNO negotiate the collective agreement, the union negotiated my benefits and salaries. And if you are working in a public hospital, they would also inform you that in order to be covered by the MECA, you actually have to be a member of a union. And if not, you have to pay a bargaining fee, which is the same amount as the annual union membership fee. So for me, it made more sense to become an NZO member when I got a job in public hospital. Having said that, if you are employed by a public hospital and you are also a union member of, say, Nurses Society New Zealand, you may not need to pay the bargaining fee. However, I'm just not familiar with what the process is like. It's best to maybe talk to your union delegate in that regard. And putting all the information together, if you're just new to a country, sometimes it's difficult to actually filter through the information. That's why for me, when I worked in a public hospital, it was just more straightforward to become an NZNO member because I don't have to ask other questions in terms of what the bargaining fee would be like if I belong to a different union. It's just straightforward. I got employed by a public hospital. I'm a member of NZNO, so I am part of the multi-employer collective agreement, which means that I am covered with the salary at that negotiating period, if that makes sense. And again, that's just based on my personal experience anyway. Other than negotiating salary and working conditions, the other benefit of joining a union is indemnity insurance. Now, there's not a lot of healthcare-related lawsuits in New Zealand, unlike in America anyway. However, it is still good to have indemnity insurance in case you are involved in a coroner's review or you find yourself in situations needing legal assistance. Renting, buying a house, car repair, dental services, legal assistance, those are all expensive services, I think anyway. So it's good to have insurance to cover the expenses. If you are enjoying this video, please hit like, subscribe, and turn on your notification bell so you would know when I upload new videos just like this one. Salamat po! So just to summarize my points, cons of becoming a union members, I think it's the fee because it can be quite expensive. So the annual cost of membership for nurses, it's $574.56. I pay monthly, so I get charged $47.88. There is also an option to pay fortnightly or every 2 weeks, and that'll cost $22.10. And again, if you just move to New Zealand and if you have to pay for CAP, MIQ facilities, processing your paper, you would really feel the cost of the membership fee. However, if you really believe the benefits that you can get from a union membership and just having that support as well in difficult situations, then yeah, there is that option, like I said, to pay it monthly or every fortnight to minimize the cost a bit, so it's not like a one-off, you have to pay $500 upfront. And there is also an option of joining other unions as well. When you're finally settled and you have a chance to actually look at different documents and talk to people, then it might be a good idea to ask around how much is the annual membership for that particular union and the benefits that they also offer. Another point to consider is that your employer may not have a collective agreement with NZNO. And so even if you are an NZNO member, they may not be able to negotiate your salary and your wages on your behalf. However, even if that is the case, I still think that it's important to become a union member in case you need legal advice or support when you find yourself in a difficult situation. And this is actually quite relevant to one of the Filipino nurses I've met online via YouTube. She moved from Singapore to New Zealand and worked in an aged care facility. And she actually faced some challenges at work. And again, when you're new to a country, you don't know anyone, it's good to have that legal advice and that sound support that you can count on. So yeah, I was really happy that she was able to talk to a NZNO representative and guide her through the process of what she was going through at that time. Otherwise, bigger aged care facilities do have collective agreement with NZNO. So example would be Radius, MetLife, Oceania, Bupa, and Somerset. Obviously, NZNO as an organization is not perfect, and I think you will come to realize it as well, or at least hear it from other nurses who have been working in New Zealand for a long time. However, it does not lessen the value that it brings. NZNO negotiates the nurse's salary, benefits, and working conditions. And the negotiating team from the last Mecca was actually very good at conveying information to its members, and they're also active in social media. The actual content on what's negotiated on, well, there's some things that I hope will improve, specifically around retirement and 𝐍𝐫𝐴𝐵, and obviously that's a conversation for another video. But yeah, overall pros, if you are a DHV employee and you want to be covered by the MECA, you have to be a member of a union, or otherwise you have to pay the bargaining fee. Unions can also offer support in case you face difficulties at work. Another nurse that I met used the service of NZNO about bullying at work. There's also another one about license renewal. There's also an 0800 number that you can call if you are a union member. And there's also union delegates at the workplace. In New Zealand, you have the right to join a union. Unions support the employees in the workplace. They bargain for collective employment agreements with employers and help employees with information and advice about work-related issues. Your employer cannot discriminate against you or disadvantage you for joining a union or taking part in legal union activities. Question of the day. Are you a member of a nurses union where you are currently working? Why or why not? Let me know in the comment section below. I hope you found this video helpful, and as always, I wish you all the best with your journey and I hope you will be blessed. I'll see you soon. Bye!